We've got Fiona with our next question. Thanks, Fiona.
Hi, so my question is regarding something really close to home. With the maternity wards, especially during COVID, there was many cases of which women were turned away because the maternity wards were so inundated. It seems that every woman you talk to who's had a child within the last 5 years has either had a horror story or knows someone who's had a horror story. And I'm just interested, if you get elected, what are you willing to do in order to ensure that women are getting the proper care they deserve and having children, especially in our public hospitals, the ones that are government funded?
Let's go to Chris Minns.
Yeah, well, thanks, Fiona. It's a really important question. I don't think there's any doubt that our public hospital system is in crisis at the moment. And it's in many cases in a worse condition than it was even during the worst parts of the pandemic. I know that our frontline workers are doing it extremely tough. I mean, here's some of these statistics. We know that 66,000 people walked into an emergency department and turned around and left without getting any treatment. 1 in 10 have to wait longer than 18 hours to get a ward place. And there's 100,000 people on the waiting list, including 4,000 children. And I've spoken to nurses at Blacktown and Westmead Emergency Department. Over 30 have resigned from both institutions in just the last 12 months. Now, think about the implications of 30 senior nurses who work in that institution for the people of New South Wales up and quitting because of the pressure. It's one of the reasons we're going to invest in skills, conditions and removing the wages cap. Firstly, in relation to skills, we're going to offer 2,000 scholarships every single year to train up nurses and healthcare professionals, paramedics as well, so they work in our public hospital system. We're also going to ensure there's safe staffing levels. 1 nurse for 3 patients in emergency departments, 1 nurse for 4 patients on the ward. And of course, the wages cap's got to go too. All I'm proposing in relation to the wages cap is that we have the ability to sit down and negotiate with frontline workers, the people that saved us during the pandemic, like every other state in Australia is able to do.